There's certainly lots of potential that AI technologies enable for kind of monitoring patients, because kind of with current models of care, we tend to base our clinical decisions upon quite subjective information. We're kind of sampling people at very sporadic periods of time. We wait months at a time before seeing people in outpatients. But people might have had a clinically relevant event a few months ago, and so it would allow for much. If we're able to objectively monitor people in between clinic appointments and kind of have flagged when a relevant clinical attacks occurred, then we'll be able to enable much more kind of relevant, responsive, adaptive models of care for people in an outpatient clinic. But it's not an easy task, and kind of in the talk I talked a lot about the difficulties with this specific form of analysis, particularly when thinking in clinical settings. I think some of the earliest work has been done in epilepsy, so there's lots of work being done looking at kind of identifying and predicting when seizures might occur, because these technologies not only help inform clinical practice, but actually having very long-term, longitudinal recording of patients lets us learn a bit more about the underlying disease process. So in epilepsy, particularly, you're able to predict the occurrence of when people are at high risk for having seizures, based upon kind of periodicity within EEG signals. So I think epilepsy is certainly one key area, but where I work, we're interested in tracking people with dementia and trying to see if you might be able to predict when clinically relevant events might occur, and things like kind of nighttime wandering and kind of other clinically relevant episodes like that. But kind of really any area of neurology particularly where people might have difficulty getting to an outpatient clinic or using technology to have telephone consultations, they're the people who could really stand to benefit from these sorts of technology if they're used in the right way in kind of routine clinical practice.